Hello, my name's Dr. Jon Steinberg. I'm a consultant psychiatrist and I'm the medical director of the Caloundra Private Clinic, and I'm also a consultant at the New Farm Clinic, which are both Ramsay Health facilities. Today I'm going to talk to you about a psychiatric illness, schizophrenia. In general, the way patients should see a schizophrenic illness is that it's to be treated when you have an acute episode. Definitely those episodes are treatable, those hallucinations, delusions. Most people get some response and some people have no symptoms. There's a group of people, maybe 20% of people, who do suffer chronic symptoms, but most people, their symptoms are treatable, so they go away. But the way we think about it is that at this stage, we can't cure schizophrenia, so we can't correct the abnormalities in the brain that give rise to the symptoms of schizophrenia. What we can do is improve people's quality of life by proper medication treatments that minimise the symptoms, good social and psychological care to minimise damage and improve their quality of life, and so that it becomes prevention. So we can prevent relapses, and that's the key to treating schizophrenia, is really to treat acute episodes and then to manage prevention over a long period of time. And in that sense, it is a treatable illness. It's very important to manage stigma and reduce stigma about serious mental illnesses, such as schizophrenia. There are ways to do this, and in recent times, the stigma of mental illness in general has been reduced, and the flags and things we can see for that in the community are that people are much more willing to talk about mental illness now than they probably ever were. For instance, people ask, there's the "Are you okay" days, for instance, and people are supporting their workers or their university students or people at schools, so it's now talked about. Now, if a person realises that it's okay to talk about emotional problems or strange perceptual disturbances or not feeling like themselves, then they can speak up. And once they can speak up, they can tell somebody, to tell their relative or tell their doctor or both. You know, that's probably the most important thing, is to feel comfortable to do that. And I also think it's important that as medical doctors and as psychiatrists and all mental health professionals maintain hope for the patients as well. And that's a way of decreasing stigma as well, that once you've got a diagnosis with an illness like schizophrenia, that you don't see it as an illness that's going to mean you'll never have a successful life, you'll never be able to have a career, you never have a family or children. It's important to be able to maintain hope that there are a large percentage of people with schizophrenia who do lead normal, happy, successful lives. So it is important to be able to maintain that, and that's a way that also reduces the stigma of mental illness as well. A person who suffers from schizophrenia has the goal of returning to work or study and furthering their career like any other person, and they need to do that. They need to feel engaged in the community in some way. So we know that schizophrenia affects people differently. So there are groups, some people with schizophrenia who have one episode, schizophrenia, don't have long-term problems. And it's those people who have their illness treated, then they go back to work. Probably around 40–50% of people, they can do that, and they can get on with their lives and lead productive lives. There are some people who do have residual symptoms of their schizophrenia, particularly we would call them as psychiatrists negative symptoms. So they're the decline in their social skills, for instance, or their thinking is slowed, they're not able to function intellectually like they used to. These symptoms might become chronic, and in those people they might not be able to get back to their job they were doing before or study their university course, but they might be able to do alternative activities such as volunteer work or other types of jobs, which, although they might not be achieving their goals, and that's a sad fact of schizophrenia, that some people do have a chronic illness that needs support and help over time, and that people don't return to the type of functioning they'd like to, or that their families wanted them to. So those people can still have their illness, but also function highly, both within families and in the community, and they absolutely do need to feel engaged in their life and with their families and in some sort of community level. So it's actually very important for people's treatment to offer rehabilitation and therapy in the community.